Our virtual event today is Weathering the Storm, Maintaining Mental Health Through the Pandemic. Attendees of this session will learn about the mind-body connection relative to the pandemic, how to identify symptoms that indicate they or others should seek help, and ways they can promote mental wellness during unprecedented times. Our presenter is Dr. Jade Letourneau, an assistant professor of counseling at Houston University in Bangor, Maine, and a licensed clinical mental health counselor, national certified counselor, and approved clinical supervisor. If you would like to post on Facebook about this event, please use the hashtags the HKN Experience and HKNx2020. At this time, I'd like to hand it over to Nancy Ostin, Director of IEEE at Kappa Nu.
Thank you, Stacy, and welcome to everyone. Really thrilled to have you with us during the HKN Experience Day 5. We've had an exciting time and still lots to come throughout the experience. But today's session I thought was going to be really important, the Weathering the Storm Mental Health Through the Pandemic. When this session was proposed, I thought it was a really very timely and important session. And thank you, Jade. It's really great to welcome you here today, and we look forward to what you have to teach us and share with us about on this topic.
Well, thank you for having me. I'm excited to be here. So again, I'm in Husson, Maine, or Bangor, Maine at Husson University. And for most of the pandemic, although I am a clinical mental health counselor, as a professor, that has really taken up most of my time. And I haven't been doing much clinical practice lately outside of clinical supervision, which we provide for our students. So within that, though, we're certainly seeing the effects of COVID, and we'll just get started. And I want to encourage everyone to go ahead and submit questions as they come up for you, and I'm happy to answer them as we move along. So when I first had conceptualized this presentation, I was thinking of the storm of COVID, and then as I was thinking about it more, trying to put this presentation together, storm didn't really fit. A storm is pretty short term. You know, we get storms and they can be really, really bad, but they're fairly short term. And I got to thinking of myself living in Maine in the winter and thinking that really COVID is more of a season, almost like a Maine winter, or for those of you who live in harsh climates or harsh winter climates, winter is long. It has a lot of facets to it, and we all experience the winter, but we'll experience it differently based on what our protective factors are, what our resources are, and what our risk factors are. And so we all have different access to different ways to help us move through a winter or to keep us safe in a winter. And that can look like someone might have a shovel, somebody else might have a snowblower, and someone else might have a snowplow to clear that snow out of the way. And if we think of all those things that can happen to us in a winter, it's very much like COVID. We are experiencing multiple threats to our security, whether that be our health, our jobs and our finances, our ability to do the things that we have always considered self-care, our ability to connect in person with other people, to keep our relationships, to travel. There's all of these different ways in which COVID is directly and indirectly affecting our mental health. So I want to talk a little bit first about symptoms and diagnoses, and to remind everyone that nothing in this presentation is designed to diagnose you. And a diagnosis really should come from a licensed professional. Well, should always come from a licensed professional. But to recognize, be able to recognize the symptoms that are perhaps indicative of a mental health diagnosis, or indicative that maybe we could use a little extra support and a little extra help. And so when we talk about symptoms, for most of us, we're talking about symptoms, and the data that I'm going to show you really related to a few categories of diagnoses. So depression, anxiety, and then what we call trauma or stressor related disorders. When we talk about depression, so symptoms of depression, which again, one symptom of depression does not mean you have a diagnosis of major depressive disorder or another depressive disorder diagnosis. It means you have a symptom of a diagnosis that requires multiple symptoms at a certain level of severity for a certain amount of time. But the symptoms can look like a lot of things. And so one symptom, sort of the cornerstone of depression, is that feeling of sadness, hopelessness, feeling down, and then that feeling is persistent. So we may have happiness or joy in fleeting moments, but really we always kind of come back to that feeling sad or hopeless. Another indicator or another symptom is loss of enjoyment in things that maybe we used to really love to do. So if we, I'll use myself, and you'll find I use myself and my own practice and my own teaching as examples a lot. I love to knit and cross stitch in my free time, and those are things I enjoy doing. And what I know about myself is it's probably time for me to seek some help when those things aren't interesting to me anymore and I don't enjoy them. So that loss of interest in things that used to really bring joy and interest to you. Tiredness, so feeling tired and drained all the time. And we can feel that when we're students and when we're teachers. I'm sure everyone is feeling that right now. It can be sleeping too much or not sleeping enough. So I can't get out of bed, or when I'm in bed and I'm trying to sleep, I don't get more than 2 or 3 hours sleep at a time. So I'm always feeling tired. And you can see how that contributes to the other symptoms. With anxiety symptoms, we're talking about that persistent worry, and we can see easily how that might go hand in hand with COVID. We're talking about worry that gets in the way of us doing the things that we're supposed to do every day. We can also have very physical symptoms of anxiety, stomach aches, headaches, that feeling of restlessness. So there are lots of different symptoms that go with depression and anxiety. And then when we get into trauma and stressor-related disorders, those symptoms can look a lot like the depressive and anxious symptoms. But typically there is an impetus to them. There is an event that happens. And in a trauma disorder, that would be related to experiencing something life-threatening, whether that's to you or a family member. So for example, I have a friend who had to drop her husband off he has COVID, was having difficulty breathing, and she had to drop him off at the ER, not knowing if she'd ever see him again. That's a traumatic event. Does that mean she will develop PTSD? No. But it means we should probably keep an eye on her and see how she's functioning over time, because it would be acute stress disorder first, then PTSD. But either way, that's a traumatic event, and we want to give her some emotional support. Adjustment disorders, those fall into the stress-related disorders, and those can be triggered or impelled by anything. That can be moving, starting a new job, going to a new school, things that most of us do all the time. There's a period of adjustment, and when the symptoms within that period of adjustment start to, again, get in the way of functioning, then that's when we would say, you know, maybe a little extra help here is warranted. So I found there's a couple of graphics online, right, of, you know, we normally have just the existential dread and maybe some seasonal depression, but we have all of these different things lining up for us right now. And it's a domino effect, really, that we are experiencing threats to our security from many different directions. And what that does is that overloads our limbic system. And our limbic system is what protects us, and it is what regulates our emotions. And it is also that fight, flight, or freeze mechanism in us. And when we're always in that survival mode, we get worn down pretty quickly. And it's also going to, our limbic system overrides our executive functioning. So if you've been walking around feeling like you're in a cloud lately, that's not something you're imagining. There's a biological and psychological reason for that. So with those symptoms in mind, I have a quick poll question for you, which is, I have experienced one of those symptoms you mentioned, either anxiety, depression, or a trauma or stressor-related disorder since the pandemic began. So I will leave that up there a few more seconds. I'm not exactly sure how long it takes, but so far we're sitting at 100%. And now I don't want to say good, but I want to say that that's not surprising to me. As a mental health clinician, I expect that most people have experienced some symptom of one of these diagnoses since COVID began. I would be more concerned if a person or a student or a client said to me, "Oh no, I'm just fine. I haven't had one single symptom of any of these since this began." So let's look at current conditions, right? Our current conditions for this winter of COVID that we are in. And this is as current as the data allows. So another, one of the challenges we have is that getting data takes time, and getting good data takes even more time. And where do you get it? So this data, even now that I'm presenting, is a couple months old. And again, though, I would say that you do not need to be a mental health professional to know that the conditions we're experiencing right now are having an effect on people's mental health. So this is comparing the period from January to June of 2019 to a one-week period in May in 2020. So the first yellow bar is, in the first graph, is symptoms of anxiety disorder. And you can see we've gone from 8.2 to 28.2%. Depressive disorder, 6.6 to 24.4%. And if you combine those, because oftentimes there's a dual occurrence there of depression and anxiety. And in my role, we sometimes call them, you know, the very close cousins. They are sometimes even hard to separate. If you've heard the symptoms, they're very similar. There's a lot of overlap. So if you put those together, we've got 11% to 34%. So we are seeing an increase in the symptoms of anxiety and depression. Again, I don't think this is surprising to anyone, but it helps to have the data to back up what we're seeing anecdotally. So in this set, we're just looking at a set of data, and this comes from the US Census Bureau, the time period of April 23rd to May 5th. So those 2 weeks, and it looks like about 3.5 weeks of July, 4 days of July 16th to July 21st. And even in that short time frame, we're seeing an uptick in the symptoms from 35.9% to 40.9%. So we're in November now. And really, this July period is about the latest period I could find good data for. So in a recent CDC study, which again was a week in June, I believe it was June 24th to June 30th, where they surveyed 10,000 people, 40% identified having one of those symptoms that we talked about earlier. So either depressive, anxiety, or trauma or stressor related symptom. 40% of the respondents in that survey identified themselves as having that. That's a pretty high number. I agree more with, I think it's closer to this group's number of 100%. 26.3 were related to a trauma or a stressor, so they could identify a COVID trauma or stressor. And here's the number where I want to spend a little bit of time, because I think it really is important. As a mental health clinician, this is one of the most important things, if not the most important thing I teach students and I deal with in my clinical work. In that 1 week period that they did the survey of 10,000 people, 10.7% reported seriously considering suicide in the last 30 days. That is a high number. That's an important number because we know in the last 20 years, suicide has been climbing up the charts as leading cause of death. And for people, particularly young people, it is now the second leading cause of death in ages 10 to 18 and 18 to 24. And so when we look at the breakdown of that number by demographics, I pulled out for you the demographic categories that really were quite a bit above that 10.7. And the highest category was 18 to 24-year-olds. Now, as a college professor and a mental health clinician, that is alarming to me. That tells me we need to be paying attention to our students and how they're doing. Black non-Hispanic is at 15%, Hispanic at 18.6%, education less than high school diploma, 30%. And essential workers, 21.7%. Remember, again, this is in early summer, and we are now in mid-fall. And unpaid adult caregivers, so those folks, those of us who are taking care of parents or aunts or uncles, family members, maybe even grandparents, 30.7% reported seriously considering suicide in the last 30 days. This is a big challenge for us and a very serious one because this is really the ultimate terrible outcome for these mental health conditions. Everything else is treatable. Suicidal ideation is very treatable as well, but once it's completed, it is not. And so I want to take a minute to show everyone then, this is one theory model of suicide. And it's quite simple. It's empirically based, and it was developed by Dr. Tom Joyner and his team. And we call it the tripartite model of suicide. You'll sometimes see it called the interpersonal model of suicide. And if we look at the three factors that research has shown contributes to suicide, we see perceived burdensomeness. That's the idea that people, my family, my friends, would be better off without me. We look at thwarted belongingness, and that is the sentiment that I am alone, things are never going to get better, I am isolated, right? So when we see isolation, we immediately, as mental health practitioners, are going to assess for suicide. Well, when we look at what the conditions of COVID have placed upon us, which is a lot of people being required to isolate, we are contributing to one of the known factors of suicide. And so if we have elevated risk in the other two factors, that's a big deal. The third factor would be that acquired capacity for suicide, which I never like things that use the word and the definition. So really what that is an acquired capacity to die, a desensitization to death. And that's why we look at military, law enforcement, frontline medical workers, certain professions have a higher risk of suicide in their nature because of what they do. Their acquired capacity to die is considered higher because of their exposure. So we have another quick little poll. And this one is, I have started or increased substance use to cope since the pandemic began. And I don't think we're tracking who answers what.
No one can be tracked here, but
okay. That's good. And I will just say for myself, so for anyone who might be thinking cope, I wouldn't necessarily categorize it as coping, but certainly when you're stuck at home all day and you're bored and there's nothing to prevent you from doing it, I wouldn't judge anyone. So we have different numbers on that. 92.9% said no, 7.1% said yes. So we're doing a little bit better than the average that the CDC found. You can go back, I'll sit on it for a few more seconds. So 6.3 and 93.8. The CDC found 13.3%. And we look at that's a pretty big number as well. And when we get into predictions in a minute, and again, we're going to come back to suicide and talk about that a little bit more, we'll understand why this is kind of important to look at and to maybe be aware of in ourselves and to be aware of in our friends and family. So we're going to look at the forecast. And what we have here is predictions based on the CDC data. Oh, sorry, we have a question. I'm trying to see the whole question. Since COVID-19 has created necessary isolation, how can we help those who are feeling these alarming feelings that can lead to suicide? And that is a great question. There's a few ways. And at the end of the presentation, I have the National Suicide Prevention Hotline number. There's also a chat that you can share and save and share. And I would look for, as someone looking out for my friends, that isolation that is increasing, so opportunities to connect and not taking those opportunities, that expression of feeling like a burden to others, and also knowing access to means is another thing to consider. So folks who have firearms in the house, and that's not a judgment on firearms, that is just something we know. That is the most often deadly method, and it's the least reversible method. So most other attempts have an opportunity for intervention. So looking at those factors, considering those for our friends and family. And then in helping, I would say, ask the question, if you have that nagging feeling, are you thinking of hurting yourself? Are you thinking of dying by suicide? I would ask. You are never going to put, and this is something when I work with students in clinical practice, when I teach crisis and trauma, that a lot of folks are uncomfortable. We're not really taught to ask that question. And I tell everyone to get comfortable with it. We're not going to put that idea in anyone's head. If they already have the idea, they're going to be relieved that you asked. We have plenty of research that supports that. There's a really good documentary, very, very difficult to watch, on the Golden Gate Bridge and the number of suicides that happen there. And there is a gentleman, his name is Kevin Hines, and he is a speaker now. He is someone who attempted suicide by jumping off the bridge and survived. And when he tells his story, he talks about going to the bridge and walking along the bridge, because we know that people do this. We have the footage, and walking along the bridge. And he says, I was waiting. And if one person would have asked me, what's wrong? And he was crying as he's walking on the bridge. If one person would have asked me what's wrong, I was prepared to tell them everything and let them help me. So don't be afraid to ask your loved ones, to ask your friends, to ask your classmates, anyone, when you suspect that, hey, something's really going on for that person. Don't be afraid to ask the question. And then just listen. You don't need to be a problem solver. We know that that isn't necessarily always the most effective way. People want to be heard and understood, and they want to feel like somebody gets it. So just access your empathy and listen to your friends, but don't be afraid to ask the question. So how do you rate?
I think that's an issue, right? So some of the people on this call could be chapter leaders. They're leading their chapter, their student groups, or in this group, HKN. And I think that's the thing, is that some people might be afraid to ask because they don't know what to say. They don't know how to intervene. They don't know how to help. And even though they want to help. So I think that was a really strong point about just listening.
Yeah. And we feel.
How someone can feel validated. I think that's really important to give people some resources for how they can do that, because again, it's a frightening word to say, to think, and then to ask someone else.
Yeah. It is, and it takes practice. So practice saying it even, and I know that might sound a little silly, practice saying it at home, or practice a way that you would want to say that to someone, or how you might want someone to say that to you. What would you want them to say? And it could be, hey, you don't seem like you're doing okay. I want to make sure you're not planning to hurt yourself. That seems to be a little more palatable to some people. And again, it is scary the first few times, and I think you'll find that it gets easier. The other options that are available to you, if you are in a university setting, for example, is almost every university has counseling services that are no additional charge for students. I've never been affiliated with a university that didn't have that service. Something else, though, that I know as a faculty member, for example, I have access to report a student of concern. And so that also could be reporting it to your RA. That could be reporting it to a professor, reporting it to somebody who may know the next steps to take if you're not comfortable talking to that person yourself, or they've said things that really raised an alarm. Maybe they didn't give you enough information, but you have that sense. I would tell you to trust your gut on that one, and know that likely somebody's going to be very relieved that you asked if that is indeed what they're feeling. How do you raise the issue with a friend or family member you believe is feeling depressed, anxious, or even suicidal? Again, you can check in, right? It seems like something's off with you. I'm wondering if you're feeling okay. When I teach basic skills, we actually don't allow our counselors in training at that point to ask questions. Questions tend to feel like prying. So people, particularly if they're not people that are really someone you would expect to open up to you. So it can be just listening and then saying something like, it sounds like you're really sad. It sounds like you're really stressed, and giving that person some time to respond to that. But I would say asking, hey, are you okay? Do you need help? Is something that would be an acceptable question. I mean, obviously we're going to ask questions, but I think just that listening piece we know is really critical. So a quick data point for you, a quick fact. When we look at therapy and what is the most important piece of therapy, what accounts for the biggest factor of a positive outcome, it's the therapeutic relationship. And every one of you can have a relationship with someone that is warm and therapeutic in that way without being a clinically trained counselor. Now, I'm not saying that means you're going to treat mental health diagnoses or do intense therapy, but when we look at what the factors for positive change are, they're positive relationships. So right now, something else we're seeing is folks are tapped out and they have no empathy left. And probably we've all experienced this to some degree. I went to Target for the first time since pandemic yesterday, and I had almost I don't want to say an altercation, but a little back and forth with the cashier, who essentially accused me of lying about something somebody on the floor had told me. Not a big deal. But my first reaction was initially like a little put out. And then I just stopped myself for a second and thought, you know, this woman has worked really hard for a really intense time. She was here when the rest of us were told to stay at home. So she's probably kind of over it at this point, and I'm going to try to access my compassion for her. So we all have that ability at different points. And sometimes we don't, right? Sometimes we are just out of empathy for folks. But whenever we can find that, we can help. And it doesn't mean we have to be trained therapists. It doesn't mean we have to know exactly the right thing to say. But any one of us can listen and try to put ourselves in somebody else's shoes. And I do have on the last slides that information of the numbers that you can write down. And again, there is a chat feature now for the National Suicide Prevention Line for folks who would rather type in and chat with somebody. So connected to this, the Wellbeing Trust ran 9 different simulations and 9 different potential situations for what they're calling deaths of despair related to COVID. So, you know, not deaths directly from COVID, but deaths of despair. So suicide and deaths due to substance abuse from being exacerbated by COVID. And the prediction was anywhere on from the 9 different models was about 25,000 to 150,000 deaths, with the most likely model falling on 75,000 deaths. So we really need to all be vigilant in this time and keep our eyes and hearts and our ears open to what people might be going through. If you notice somebody who's been, for example, depressed for a long time or kind of down and out for a long time, and suddenly they're in a good mood and they're getting things in order, that is actually a red flag for suicidal ideation. It means they've come up with a plan, and there's a phenomenon of relief that happens within that, so they feel something is lifted, and that's something we're also taught to look for, but it's something any one of us can look for. So whether you're a student and you notice in your fellow students, or a teacher, or an advisor, to kind of look out for that too. When suddenly somebody's feeling 100 times better than they were the last 15 weeks. So could you offer suggestions on what to do when we feel moments, or anxious moments or longer periods of time? I don't see anything returning to normal. And I'm so tired of hearing the term new normal that actually makes it worse. Okay, yes, I do. So I'm gonna go ahead and move through, whoops, wrong button. What can we do? So what can we do about this? Because this is not all doom and gloom. And I meant to give that caveat in the beginning. It looks bad. And I'm not saying it isn't bad, but we have ways, we have evidence-based ways to help us get through this. Some of them are simple. That doesn't make them easy, but some of them are simple. I'm going to show you. So one of the things that we tend to look for, and within this I promise I'm going to answer that question, right, is in counseling we really operate from a strengths-based and a wellness-based approach. So there's little tiny differences in the different types of therapists you might get. And if you were to go see someone, I would ask them, what is your approach to this, to therapy? What is your orientation? How will working with you look? But one way that many of us, though, approach the work is through this model of the Indivisible Self. And this is a wellness-based model developed by Myers and Sweeney. And it really, through factor analysis, there are these higher order wellness factors. So really these 5 big pieces of our self, and they're all interconnected. And what tends to happen is 1 or 2 of them get out of balance, and obviously that affects all of them. So when you're looking at, okay, I'm anxious or I'm depressed and this has been lasting for a while, and what can I do? One of the things is to look at these 5 pieces of self. So your essential self is your identity, so your cultural identity, your gender identity, your spirituality, your religion, your faith, all of those very personal pieces, and your self-care. Your social, or your relationships, your friendships, and your love, and that may mean whatever it means to you. That's not defined by us. Your coping, and this is sometimes where our anxiety gets provoked in here through not being able to cope with the way things are. Creative, so coping is really that stress management, leisure, Realistic beliefs. So connecting that to the new normal. We get it. We're here for a while. So how can we realign ourselves into realistic beliefs about what's achievable and what's not in this moment at this time? You have your creative self, which is how your thoughts and emotions connect. And this really works into your work. What do you do for work? How do you create things? Your hobbies and control. When we talk about control, that is not controlling others. That is control of ourself. And really self-regulation. And then physical, so our exercise and nutrition. So one way to start can be to look at all of these pieces of yourself and see which one of these is really the most out of balance, because that's likely affecting the others. And so I will give an example for myself. I would say for me, social and physical are the most out of balance. And again, that's affecting everything else. I'm an extrovert. And so for those of you, I know we use those terms a lot, right? Essentially, an extrovert draws energy from being with other people. And an introvert draws energy from time alone. That doesn't mean that introverts don't like people or don't like being around people. It just means that to recharge their batteries after being around people, they need some alone time. And it doesn't mean that extroverts don't like to ever be alone. It just means that they draw energy from being around people. And that can look different for different introverts and different extroverts. But anyway, I am an extrovert. So I do thrive and I get energy from being around other people. So isolation, when our state was in shutdown, was challenging for me. Not being around other people for weeks at a time. And then I noticed too, as somebody who goes to the gym a lot, but has everything I need to do my workouts at home, I will not work out at home, because part of the reason I love going to the gym is that social element. So those two are really affecting each other for me. And then I can see how the rest of that, how those two are really affecting other things. So it can be, what do I feel is the most affected by this situation of COVID? And really starting, this can just give you a starting point. And then from the others, where am I doing the best? What really tends to be going pretty well for me? And using that as your strength point to help you build the other areas where you're out of balance up. So some practical and more tangible and concrete suggestions for you regarding, and these are things that are helpful for those depressive and anxious symptoms, right? The first is routine and a schedule. And that's one of those things that sounds really simple, but can be very hard to do. So again, an example from my own life, when we went as a professor, we moved everything online in March, and we're told to work from home. And I noticed that I was spending 15 to 18 hours a day, or 15 to 16 hours a day at my desk working, and not really taking any of the breaks. I never spent that much time in my office here. And I wasn't taking the breaks that I normally did when I'm in my office. So I'm on campus, I walk around, I teach in a classroom. That's an active part of my day. But also when I go home, I'm pretty much leaving. We never leave it all at home, but I'm pretty much going home. And so really my routine was completely disrupted. And when I had no routine, I was then spending way too much time working. Some of it was necessary to get done what needed to be done, but some of it I really had to look at and say, well, what can wait? And then I didn't have my routine of, okay, well then when I get off work, I go to the gym. After the gym, I go home. So putting a routine back in your day is really important. And I see this a lot in students that I work with too. And there's a really excellent TED Talk. If you all want to look it up, I think it's called Inside the Mind of a Master Procrastinator. But when we don't have a routine, we tend to sometimes, some of us, not all of us, but it can be very then anxiety producing because we let everything wait until the end. And then we're working overtime to try to catch up. So one of the ways, and this applies to sleep too. We know that sleep and getting good sleep is so foundational to good mental health. So going to bed at the same time every night and getting up at the same time every morning. And that isn't necessarily always easy to do depending on how our schedules look. But the closer we can get to a set sleep routine, the better we will feel. Connection is another thing. And I think that we all know now Zoom, and I can remember when quarantine first started, having Zoom cocktail parties with friends. And those aren't fun anymore, but it may be the only opportunity we have to connect with people. And so something else to keep in mind is connecting with your family and your friends and your loved ones, perhaps one-on-one or with scheduled phone calls or just text messages. I know for me, I have a group of friends who I text message all the time, and that's kind of my way of keeping connected, and it allows us all to do it on our own time and we don't get the Zoom fatigue. And for those of you who might be working a lot on Zoom, Zoom fatigue is real. It is, there is some research that has come out about it, and essentially, when we are together in person, we're reading body language all the time, and it's pretty easy for us to do. We're not thinking, these are unconscious things that we do. And then when we're on Zoom, our brains are having to work much harder to interpret what we can see, which is typically just facial expressions. We can't see the rest of the body. And so our brains are working much harder in that information processing of trying to figure out what's going on with the other person. So Zoom fatigue is real for those of you who might be feeling wiped out after a day on Zoom. That's a real thing. And so maybe you don't want to connect with your friends and loved ones via Zoom because you've just spent 8 hours in meetings on Zoom. So finding other ways to connect with people, and certainly social media. And we know, right, we know that that can be a great place to connect and find support and validation and people who are experiencing what we are experiencing. And we also know it is not always a healthy interaction. Don't read the comments, right? Some other things, again, and they seem simple, and we've probably all heard them before. Moving your body, and whatever that means for you, whatever exercise means to you. And there are a lot of free options if you don't even know where to start. YouTube or Instagram, there are options for yoga, for workouts. Again, all within your ability, all within what you're comfortable with. But we know that moving our bodies helps us feel better. It releases endorphins, that it does help us. And I am certainly, as I said, without the gym, I'm really hard to motivate to work out on my own. And then I will sort of get into that shame cycle of you should be doing it, you should be doing it, you should be doing it, that I hate it the whole time I'm doing it. And then I feel amazing when I'm done. So finding a way to do that. And there are ways, even in small spaces and with just body weight, that you can do that. Because I know that some of these resources aren't available to everyone. Food and nutrition, another one. I mean, that's very much rooted in your socioeconomic status, what types of food you can afford, but trying to eat as best you can. We know too that helps us feel better. So coming back also within this question of what can we do when we have those anxious moments for longer periods of time, counseling services, therapy services. For those of you who are in a university, you likely have cost-free access to counseling services. And I highly encourage anyone who is experiencing those symptoms, which 100%, that doesn't mean you're going to get a diagnosis. It doesn't mean that you have to go forever. It doesn't mean you're going to like the first person you see, but you have access. If you're a college student, you most likely have access to counseling services. Right now as well, and it all depends on where you are, but HIPAA rules have been loosened for telebehavioral health services. Each state also has their own rules, but most of them have opened up the ability for telehealth counseling to take place, which has been living in a rural state. That's actually been very, we found it has increased access greatly to our client base here. And it was also helpful for students when they were sent home last semester. So we are live this semester. We are a campus that is having in-person classes, but our counseling center can do both. So you likely have that access. For other folks, there are some ways. If you work for a large company, you likely have an employee assistance plan, and that gives you access typically to mental health counseling, depending on how your employer handles it. I've known some employers have it in-house. For example, in Maine, we have LL Bean, and I know that LL Bean has an in-house counseling services for their employees as part of their employee assistance program. But most EAPs offer counseling sessions, and most insurance plans, for those of you who have certain insurance plans, will cover a certain amount of sessions each year with an opportunity for more. If you do not have access to those resources, which I know is many people, if you are near a university that has a clinical counseling program, a marriage family therapy program, a counseling psychology program, then you might want to call one of those universities. Many of them, shouldn't say most, but many of them have training clinics where they're interns. So they're graduate students who are finishing up their degree requirements have to do, I know in my profession, we have to do a 900-hour clinical internship. So 900 hours working with clients and diagnosing and treating and that being highly supervised by clinical supervisors. And they will offer in their training clinics free or low-cost services. So I know here at Husson, although our clinic is not currently open, and it was just getting off the ground, it is free service to the community. Other universities I've been affiliated with has been a $5 or $10 fee, but again, that's all negotiable based on if you couldn't afford to pay, we would certainly work with people to get them services. So there are those options as well. And there are sometimes more access to resources than we may be aware of. So I mentioned not too long ago the National Suicide Prevention Lifeline, and it's 1-800-273-TALK. And there's also a chat, which is suicidepreventionlifeline.org/chat. So you can log into that. You can save that and share it. As well. Whoops. So, was there a question? I'm sorry.
No, so this is the National Health Line. I was going to ask you, Jade, if there were other, if she wasn't quite at the level of suicide, but people just need help and they're not ready to go to a counselor. So is that what the next slide is going to be? How can they just need to talk to someone.
Yeah, you can, SAMHSA has a national helpline that can put you in touch with services. There are, most of them tend to be, even if you put, so I'm going to say, sorry, if we go back to the National Suicide Prevention Lifeline chat, they might be able to put you in touch with resources. I can also share on the CDC's website. There is a whole page of resources for COVID mental health. And I didn't want to overwhelm everyone with all the different ones. So these were sort of the two big ones. The SAMHSA's National Helpline can get you help, can put you in touch with services in your area. A lot of, and these would be more regionally or locally based, have what we call warm lines. And those are like you're talking about. So you're not to the level of suicidal ideation, but really you could use someone to talk to. And that's what the warm lines do. And they're typically run by either nonprofit organizations or large community mental health agencies. But that would be more of like a state or regional level. And anyone can reach out to me and I can help you find those resources. I'm happy to help you do that.
So that's really great, because I know, in Handicap and you, like I said, we interact with each other. We're a community of communities. And so there's local, chapters that are organized at universities, and certainly it's a lifelong connection. So we want to make sure that we empower our people, our wonderful students, to go and make sure they're helping others, whether it's in their chapter or in their university. How can they express that empathy in a positive way to help people get through? And maybe some of the other fun things, I know we've talked to our chapters about, even just doing fun engagement things like online games and other things, reaching out. Even if you haven't heard from someone, doing a special reach out to make sure that they're getting your emails, or maybe that they're seeing some things. Maybe if you haven't heard from someone, it's the person that really needs you to reach out to them, because those that are participating don't need the help. So probably they're kind of figuring out who hasn't been.
Yeah, that is an excellent point, that noticing who isn't showing up, So, Jennifer used to come to every meeting and we haven't seen her in 3 meetings. I would say, yeah, reach out to Jennifer as an example. And perhaps even having I'm wanting to say phone tree, and that is such a dated term, but essentially a kind of a rule. If we don't hear from someone in X amount of weeks, we're going to reach out to you and make sure you're okay.
So I think that is one thing that students can do for each other. They can just be that first line support. So you can always go and report this to a professor, as you said, or go to your faculty advisor. And try to seek out resources on campus, but you don't want to let those things go unchecked, because people need your help. Like I said, I think just being a listener. I think listening is probably the most powerful thing you can do for someone who's just going through a time that they don't think they're being heard or seen. That's the toughest thing. I know, and I'm in contact with people all the time. So, but still, at the end of the day, I don't want to call my friends or even be online or do anything, because I'm so tired. So it is pretty tough to stay connected in this world. I think you have to really work at it. I think you have to have a plan. You do, and that's what we're. The concern is now that it's getting colder, at least for those of us in areas where we have a harsher winter. A lot of those outlets we had for getting together with people aren't available, or soon won't be available. So, the upside was we had record numbers of people getting outside and doing things, and that's just not right. And holidays are always the toughest times, right? I think sometimes we talk about it as the happiest time of year, but it could be the toughest time of year. I think people have to remember holidays can be really, really tough, especially this year if you're not having traditional holidays.
Right. Yes. Holidays are double-edged. They are typically in our memories a wonderful time, but in the moment they can be very stressful, because there's a lot of expectations around holidays. There's a lot of family relationships that we have to navigate that maybe we avoid for the rest of the year. So it is not, it is certainly a time when we see a lot of symptoms become exacerbated, and that's going to be no different this year.
Well, I know at IEEE, in our department, they actually give us access to an app called Headspace. Not advertising that one, but it's a meditation app to do, quick meditations, something to take you, kind of clear your head a little bit. So I think, any way that you can, not respond, but breathe and not respond in these very stressful times probably is, these strategies that we can learn. I think there's some learned behaviors that we can have to help us cope when we're feeling these kinds of stress.
There are lots of different apps, and I haven't reviewed them all to know, but and some are paid, and I'd take a free trial first, but also some simple things that anyone can do. So I do tell folks, make sure you get away from your desk for at least 5 minutes. Like, go walk around. I don't care if it's walking around your house. Get up. Almost seems like things that we did as kids in school, like shake it out, move, and get that energy moving. And along with the breathing techniques and some mindfulness exercises, one that is really simple that I can teach everyone in about 30 seconds right now is the 5, 4, 3, 2, 1. And essentially it's engaging each of your 5 senses and bringing yourself into the moment. So when you're having a moment where you're feeling really disconnected or really overwhelmed, to name 5 things you can see. So describe 5 things you can see. And 4 things that you can hear. So what are noises that you hear around you? 3 things that you can feel. And so, I can feel sort of my legs are crossed and I can feel one of my feet getting a little tingly. But those types of sensations, what are you feeling? 2 things you can smell and 1 thing you can taste. And what this does is it just brings your awareness to the moment and to your 5 senses. And it can be very much a relaxation technique when things are getting overwhelming or you're feeling like you can't focus.
Well, that's really great, Kate. Thank you. So in 30 seconds, keeping us some quick way, some in the nomenclature things that we can just maybe do to stop when we're feeling overwhelmed or just wanting to respond in a way that may not be positive. I think that's great. Well, we're coming up to the end of our hour. Any final thoughts you want to share with our audience?
Just that, I am certain that everyone is doing the best they can. And that's, I think we tend to get into a bit of an argument I'm seeing, again, when I talked about that lack of empathy, that, well, who has it the worst? Well, we all have it the worst because my worst is different than your worst is different from, we can't compare ourselves to other people. We are all in our own situation and we're all doing the best we can. And really to have patience and compassion with that.
I think that's really great advice. Well, again, thank you so much for sharing your expertise with us and your time today. I think it's an amazing session. I think we can go out and talk about 5, 4, 3, 2, 1. So I think that might be something we can share with others. But thank you for everyone who's attended today.